Hello friends, today we will be talking about donor IVF cycles. Now donor egg IVF cycles are offered in couples where the woman cannot use her own eggs. Now ऐसी कौन सी conditions हैं जब कि एक lady अपने खुद के eggs use नहीं कर सकती. Now the most common reason for offering a donor IVF cycle is advanced age of the mother. In such women, what happens is that the egg quality and the quantity are both poor because of her age, advanced age, as a result of which the embryo quality would be poor. So, such women can be offered a donor egg cycle. Sometimes we also find that women who are younger but still they have a poor reserve. So, younger women of the reproductive age group having a poor reserve can also be candidates for a डोनर एग आईवीएफ साइकिल. जैसे कि हम जानते हैं कि कई बार मेनोपॉज के बाद भी पेशेंट्स आईवीएफ के लिए आते हैं. सो इन दीज वुमेन वी सी दैट देयर इज ऑब्वियसली नो ओव्यूलेशन, देयर इज नो मेंस्ट्रुएशन, दे डू नॉट हैव एनी एग्स लेफ्ट इन द ओवरीज. सो सच वुमेन obviously need to be given donor egg cycles. Sometimes we also see that in our OPDs there are women who have been given IVF cycles earlier, और उन IVF cycles में उनके embryos की जो quality थी that was poor, and it has been documented that they have had poor quality embryos in the previous cycles with self eggs. So in such women we offer donor cycles. Similarly, अगर कोई women हमारे पास आती है जिसके पास unexplained IVF failures हैं, so in those patients we offer them a IVF with donor eggs. Sometimes also women have genetic abnormalities in view of which women have poor quality or genetically abnormal embryos, and as a result of which we have to offer them a donor egg cycles. Right, so these are in a nutshell the indications, कारण जिनमें हम IVF through donor eggs करते हैं. ठीक है, so we have to synchronize the cycle of the donor as well as the intended couple's female partner. तो हम क्या करेंगे, हम eggs को stimulate करेंगे donor के, and simultaneously we will also form the endometrial lining of the intended couple's female partner. Now once the eggs are picked up in the donor, the semen of the husband is taken and the embryos are formed. So we have embryos ready with us. Now as per the gynecologist's choice, either they are transferred in the same cycle if the intended couple's womb is good, so we will transfer in the same cycle, that's called a fresh transfer, or it can also, all the embryos can be frozen in case the endometrium is not good, and they can be frozen and then they can be transferred subsequently in the other cycles after in the frozen cycle. So that's called a frozen embryo transfer, right? So that gives us also the flexibility of changing the timing of the transfer. Now the advantages of a donor transfer is that donors transfers usually have a higher success rate as compared to self cycles.